Hey, what's up, everybody? This is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance, based in New York City. And because of everything that's going on in the world, we have been putting out these episodes on a day-to-day basis called the Audiologist at Home episodes, which is basically myself and my colleagues, Dr. Alexandra Zweig, Dr. Ariella Naim, where we answer questions that we get in our practice on a day-to-day basis, some common questions, and also some questions that we're getting from our info@newyorkhearingdoctors.com email address. And today I have my colleague, Dr. Zweig. What's up, Dr. Zweig?
Hello, good morning.
Good morning. How are you?
Pretty well. We've almost made it 3 weeks
I know, it's
of
amazing,
our
right?
home audiology episodes.
It's amazing. I can't believe it's actually been that long that
I
we've
know.
been indoors, but clearly it's for the better. And it seems like what we're doing in New York is starting to help a little bit.
Mhm.
There's little bright lights of positive outcomes from the numbers we're seeing. But look, we'll do this as long as we're home. So,
Yeah.
so today there's a question for you, and the question is: how do you appropriately fit, or how do you make sure a hearing aid is appropriately fit?
Okay. So before I get into detail of this, I just want to say full disclosure. This is how our practice functions as best practice. It might differ from practice to practice. So I'm going to kind of talk about what we go through from appointments after discussing what style of hearing aid and the appropriate measurements we make going forward.
Gotcha.
So once a patient and the patient and I, or the patient and the audiologist, decide the appropriate style of the hearing aid, whether it's behind the ear or in the ear, as well as the level of technology, we move on to the fitting appointment. The fitting appointment in our practice, we do start it pretty basic. I think the fitting appointment, the most important thing is to allow the patient to understand how to put the hearing aid on, basic things like changing a battery or recharging the hearing aid, as well as the cleaning techniques. For fitting the device on that first appointment, we do start with a very conservative approach. We do like to start with hearing aids at maybe about 40 to 50% of what we call full prescription. And by full prescription, I'm talking about the manufacturer, what the manufacturer believes is the appropriate gain for that person's hearing loss, to treat their hearing loss or to provide the appropriate speech information. But something to keep in mind when I say that is that hearing aid software calculations are based on an average ear canal. So it's the average ear canal, average size and shape. So it is very basic for every single person that is fit despite their anatomy. So it's important that we follow up with some other measurements to truly appropriately fit a hearing aid. And one of those measurements after the first appointment, we see the patient about 2 to 3 weeks after that, and then we start running the measurements to make sure it's fit. The first measurement that we run is called a probe mic or real ear verification. So two ways that we two words I'm going to use is verification, which is more of the objective measurements, and the validation, which is a little more subjective. What are some questionnaires we use to determine if the patient is benefiting from their perspective? So let's start with more of the verification. The verification is allowing us to collect objective information of what the hearing aid is producing on that patient's ear. So what's involved in this is we set the patient up, usually in a quiet environment. We put a little microphone in the patient's ear canal, and we're able to measure at each frequency if the hearing aid is producing the appropriate gain or amplification for that patient's hearing loss. Ear canals are their own natural resonators. A small ear canal might change the resonation or the gain at a specific frequency, while a large ear canal can do the opposite.
Sure.
So we don't truly know if we're fitting a hearing aid appropriately unless we run these measurements. So that's how we kind of get the accurate and detailed information. I think that's a really important best practice. Then, throughout the fitting, we are working on validation, which is through kind of questionnaires, but also through dialogue between the professional and the patient. We get a lot of information that helps us, specific information. What environment were you in when you didn't hear well? Or what environment were you in when you did? Tell me where you were sitting, who was around you, how many people. All of that's really important information to kind of fit that device appropriately, or not even appropriately, but to the way the patient also wants it to be fit. So it's the objective and subjective. Some questionnaires, that we use in our practice is called the COSI, which is the Client-Oriented Scale of Improvement, just something to monitor patients' progress going forward and how they feel that they're doing. And then something else we do is what's called quick SIN. So after we've done real ear measurements, we validated or verified that the hearing aid is functioning appropriately. We then do some measurements called quick SIN. And what quick SIN is, it's a speech and noise test. And a hearing test in general tells us the kind of the integrity of the auditory system, so how each part of the ear is functioning.
Mhm.
It doesn't really tell us how the individual is hearing in different situations or how they're processing sound. So a quick SIN is a really good way to tell us how the brain is processing noise. And that's something that what I've done is I see a patient, I do quick SIN with and without the device, so determine without the device at a specific intensity level or volume, how that patient is processing speech and noise, and then with the device. And then we kind of monitor that every 4 to 6 months to determine if that's getting better over time with just consistent use of the hearing aid. So I would say that's kind of the fitting process. And that all happens within maybe about 8 weeks, different for every individual based on
Sure.
their experience. But within the first 8 weeks, I would say the individual, the patient is fit appropriately.
Definitely seems like a comprehensive approach to verifying and making sure that the person subjectively is fit appropriately, because there's
Mhm.
so much subjectiveness when it comes to sound, especially when you talk about different brains, how they're wired, perception of speech in a background of noise, likes, dislikes, all these different things come into play. So it sounds like what you're describing is a beautiful mix between science and art, right?
Mhm.
There's this nice mixture, and it's very collaborative with the patient. While there are some measures that really require no feedback from the patient whatsoever, those
Mhm.
are important to get us a nice baseline of what's going on. But as you're going forward, fitting patients and fine tuning over time, the subjective part comes into play more and more
Right.
over time. Yeah, I think it's interesting because historically, a lot of these measures by most clinicians, and I'm not pointing fingers at anybody, clearly, this is what we do, this is what we choose to do in our practice. But some places decide not to do verification and they'll just use manufacturer's first fit, meaning what you were describing at the beginning, that
Mhm.
first stage, that's the end point for some people.
Mhm.
So what you're telling us is that we have to be educated and make sure that make as a patient to make sure that we're getting these verification measures, at least some of them, so we can objectively measure what's going on inside of our ear. So
Yeah.
that's great information. Great information. So thanks, Dr. Zweig. Appreciate that as
Okay.
always today. Stay well. And for everybody out there who has questions for us, again, you can send them to info@newyorkhearingdoctors.com and we'll answer them in an upcoming episode of the Audiologist at Home episodes. Again, Dr. Zweig, be well. I will see you soon.
Thank you. Take care.
All right. Have a great day. Take care.
Thank you. Bye.